Let's talk a little bit about the background of an RHC. We know that the Rural Health Clinic Services Act was developed in 1977. That act was actually created to help with the healthcare shortage in the rural America. Physicians were very short. It brought on board at that time an increase in the healthcare providers, such as nurse practitioners, and any mid-level provider, actually, physician's assistant and so forth. They were all bought in to help with that shortage and to be able to combat the shortage there in order to take care of our people in rural America. The actual program is governed and run by the Center of Medicare and Medicaid. They do the administration and they manage the regulations of that process. Currently, we have over 4,000 plus RHCs in the area. They are growing daily. I know that you see them coming around in your area, and they're moving a lot. One of the purposes that we wanted to bring rural health clinics to the rural America was to improve the quality and access of primary care services. Many of the underserved communities ran into difficulties and problems as they don't have public transportation to be able to move them to and from physicians' appointments into the larger cities. They depend on their children to take them to appointments. And as we know, it's not always easy to leave work to take mom or dad to an appointment. So this was available to them with the rural health services. Plus, it was great as far as being able to just walk in and get services when they need it, because oftentimes folks don't think ahead of time to make appointments, or they're not sick at that the day before. They're sick the day of and need an appointment. So it gives them a place to go. It promotes a collaborative model, which I think is very good between the healthcare delivery system, both with physicians and non-physician providers. And now we're finding even more that it's working within the community among the nursing home patients, the home health agencies, and everyone is getting involved to make a more unique method of care for our all of our patients out in that area. It's a total balanced care for them.